Hi everyone, thank you for joining me today. I'm Dr. Bita. I work at Cancer Center for Healing and Center for New Medicine. Before I start talking about my topic, I want to mention, as some of you know, I used to work at 3 to 4 different urgent cares before I started Cancer Center for Healing or Center for New Medicine. And I would see a lot of patients coming in and requesting antibiotic, even though after my exam I would think it's a viral infection and it's not really antibiotic is not necessarily. Patient would say, I got exactly what I had last year and I got a Z-Pack and it got better. I really need that antibiotic. Or I would see patients who went to urgent care and they got an antibiotic for sinusitis and it's really a viral infection. So I want to tell you guys some tricks, some symptoms, so you guys could distinguish between bacterial and virus, so you don't go to an urgent care and ask for an antibiotic or you start an antibiotic. So as some of you know, I have a baby and my baby would spike fever to 101, but I didn't take him to the pediatrician and get an antibiotic for him. What I would do is I would see, would that fever go down throughout the day or at night? Would it break by itself without me giving medicine? Because the purpose of fever is to boost our immune system. You want to have that fever. You don't want to give Tylenol and ibuprofen and bring the fever down. That's just a sign for your immune system cutting, go after the virus or bacteria. So if the fever by itself goes down and then it spikes up again, it's most likely typically is a viral infection. And usually viral infection fever, it should be done after 5 days. If it continues more than 5 days and it's constant, it doesn't break, it doesn't go down, or baby or the kid have fever constantly, then maybe it is a bacterial. You want to take the kid to the pediatrician. But with my boy, what I would do is I would use cold cloth. I would give him some homeopathy and some vitamin C. As he was 6 months old, I would give him vitamin C. I would give him zinc lozenges. I would give him when he was sick, and also bring his temperature down with cold compresses, and his fever would break, and then after a few days he would feel fine. The key is you want to make sure you hydrate the kid. You want to make sure they drink fluid. I was breastfeeding at that time, so you want to make sure they drink and they're not dehydrated. Sign of dehydration is not good. If you see they look dehydrated to you, or they vomit, they're not taking or drinking, you want to take them to urgent care or pediatrician. So in terms of adults, the same thing. If you have fever and if you have chills, night sweats, that's a sign of bacterial infection. But if you're 70 and 80, your body, you may not develop fever or chills. So if you feel like your cough is getting worse after 3 days, everything gets worse, do go follow up with your doctor. You could do a blood work. You could do a simple CBC, and you could see if you have a shift, if you have a bacterial infection or not. So, but as an adult, if you're younger than 70, usually if you have sinusitis, for example, which is sinus pain, you look down, you feel dizzy, you have this congestion, postnasal drip, you may have cough, you want to be patient. You want to wait up to 3 weeks, because those are usually viral and it gets better by itself, but it does take 3 weeks. So after a week of this, don't go to an urgent care and get an augmented antibiotic, get started on it for 2 weeks, and then after you feel better, you think it was antibiotic, but it wasn't. It was the 3 weeks time zone, you got better. So if you have runny nose, congestion, you could take Sudafed, you could use normal saline to rinse your nose, you could use nasal spray to prevent the drainage so it doesn't drain into your sinuses, so you don't develop sinus infection. And if your fever, if you do get sinus headache, if you want to take ibuprofen, you can. And our office, if people get sick, we give them IV vitamin C, but you could do oral vitamin C at home. You could do high doses up to 2 grams multiple times a day. If you do get diarrhea with vitamin C, then you know you took too much. You just decrease that dose of vitamin C. But vitamin C really helps to shorten the duration of your illness and get you better faster. And also doing zinc lozenges, you could do that 20 milligram 3 times a day. There are colloidal silver you could use to feel better. So in terms of bacterial, when we need antibiotic, that's when you have the high fever and it doesn't break by itself. You have fever from morning till night, constant fever, chills, night sweats. Then yeah, you may need antibiotic. Do go to urgent care, but you could always request a CBC. That's a blood work they could do, and then you could see a shift in your white blood cell. Neutrophils will go up, and that's a sign that yes, you have a bacterial infection, you need an antibiotic. But please don't just take antibiotic, because it does cause more harm. It messes up your gut, it kills all the good bacteria, and it makes your body more resistant. So in future, if you get pneumonia, fever and cough and a greenish sputum and all that, and you need that antibiotic, you may develop resistance to it because of your history of just taking antibiotic without no reason. So, and also coughs, a lot of people say, I have this greenish phlegm, I think it's bacterial. No, the production, if it's phlegm is inside your respiratory system for long, it changes color, it oxidizes, it gets darker, it becomes green. It doesn't mean it's bacterial infection. With viral infection, you could also have green phlegm. It's like blood. When your blood is cut, right away it's bright red, but after a while, when it oxidizes, it gets dark. So it's the same thing with phlegm. So it's just a misconception saying, oh my God, I have this greenish phlegm, I must have bacterial infection. No, it's not. So today though, my topic is, how do you prevent from getting sick? How do you prevent from getting flu or bacterial infection? Getting a flu shot doesn't really prevent you. And why? The reason is when they make a flu shot from that virus constantly mutate and change. 2 days later, the same virus is not going to respond to that flu shot. That's why last year, 50% of the people who got the flu had the shot, they still got the flu. So that doesn't save you necessarily. If you want to get the shot, be my guest, but I'm just saying. So what really saves you is have a strong immune system. How can you have a strong immune system is make sure you sleep well. Make sure you don't consume a lot of sugars. So when you're feeling like there is something coming, you're getting sick, if you consume sugar, you are feeding that virus and bacteria. You right away want to change your diet. Don't eat sugar. Sometimes when you're sick, you crave sugar. You think, oh, I need sugar to get energy. But remember that sugar feeds that bacteria, feeds that virus, is going to make you sicker long term. You want to make sure you have chicken noodle soup that are good nutrients, protein in that chicken broth that you're making fresh, that can help you with the healing. You want to make sure you take vitamin C, as we discussed. You want to make sure you take zinc. You want to make sure you don't stress, you rest, you take time off. You don't exercise too much. Some people think, oh, I'm sick, but let's go exercise anyways. Exercise does suppress your immune system when you're sick. You don't want to do that. Sometimes sauna is helpful. You could sit in a sauna 10-15 minutes, or infrared sauna, that can be good. But really you want to rest, take it easy. And what else can you do to boost your immune system is decrease stress. We have IV vitamin C that I have patients do if they want to travel somewhere. I make sure they do IV vitamin C. They take airborne with them. They take this product that I discussed, vitamin C, colloidal silver, zinc. You have all these stuff with you, and you eat healthy. Probiotic plays a key role too. Probiotic helps you with the illness. even upper respiratory infection, probiotic helps you with the gut, and it can help you with overall immune system. So you want to make sure your immune system is strong. You want to make sure you sleep well, you don't exercise, you rest, you eat healthy, you drink green juices, you do honey and tea. Honey and tea is good. And some people who cough, a natural remedy is to mix honey with cinnamon. And that can help. It could be a natural cough suppressant. And if you do need to take medication for body ache, you could take ibuprofen. It's better than Tylenol, but you want to make sure you take it with food. Tylenol has a lot of liver toxicity. I'd rather you guys don't take Tylenol PM, Dayquil with Tylenol, because it does damage the liver. Ibuprofen, if you get heartburn, if you have ulcer, you want to avoid it too, or you want to make sure if you don't have ulcer, you could take ibuprofen, but make sure you take it with food. And then you could do Epsom salt bath. That helps with the body ache when you're sick. You make a bath and it helps you to sweat and it makes you heal faster. Thank you for joining me today. So if you have any questions or comment, please leave it down below. I'd be happy to answer them. And if it's any topic that you guys want me to talk about next time, I'd be happy to do that. Have a great day. Bye.